we're all learning together and learning from each other. The tasks that are currently being implemented by specialists and how do we therefore increase access, what best practices they have and what we can learn from each other. If we are not able to measure what we're doing, then how do we know if we've succeeded? I think the advantage has been having a multi-site project that is in similar settings but in different parts of the world. And I think that allows us an opportunity to, through the project, learn what other people in other countries that have similar challenges to us, how they're dealing with them, what best practices they have and what we can learn from each other. So because most of the time we're struggling with the similar issues, but having this project that is multi-site and bringing together policymakers from different parts of the world with similar challenges is useful in that we're all learning together and learning from each other. Just about all the packages of the Emerald program are relevant for us in our province. Capacity development is a big issue. How do we train in particular generalists to take on more of the tasks that are currently being implemented by specialists, and how do we therefore increase access to mental health within our health system. The issue of policy development, what are some of the integrated models of care that we should be putting in place, intersectoral collaboration, indicators. One of the issues we know is around measurement. If we are not able to measure what we're doing, then how do we know if we've succeeded? So I have been part of the policy makers that have been interviewed, have provided input into the Delphi study on the indicators. So it will be quite interesting to see what are some of those minimum core indicators that countries will agree to collect. So there are many things that are coming from the project that will be practical and applicable in our province. I think one of the challenges that I see is how we can provide mental health services in the context of other chronic conditions, and this whole issue of integration. What exactly do we mean, and how does it find its expression at service delivery level? And I think that is one of our key challenges, to integrate, but then at the same time make sure that we have access for mental health conditions as well.